All right. Good afternoon, everybody. Scott from NerveSpa here. I am here today with Dr. Sebastian Castelli from Castelli Chiropractic in North Florida. He's been good enough to chat with us about our NerveSpa Knee Pro for short. Um, Sebastian, good to have you here. And you've been working with us, geez, for a hot minute, huh?
Yeah, now that I think about it, it's been a little while. So yeah,
Time
for sure.
flies. Time flies. So
No, certainly does.
so I think, and this is obvious, that it certainly means a lot more coming from a fellow clinician than coming from me to talk about our products. And you've been using the NerveSpa Knee Pro for a while now. I believe you've had several patients, um, that have been using it. So I guess what I'd like to ask you is, why you have it as part of your program. Do you find it easy, or do your patients find it easy to use? And genuinely, I'd like to know if it's helped your patient's recovery. To that end, I'll be quiet and turn it over to you.
Okay, yeah. No, I appreciate it.
Sure.
So I'll start real quick with just, a little bit of the science. Because you guys have it set up at that 7.83 hertz. And so
Correct. Yeah, that's
to
the first
educate my
part of the.
patients about, yeah, I educate my patients about the arthrogenic inhibition, right? So as I'm doing my exam with them,
Mhm.
as I go to muscle testing, I always take like little 5 minutes to explain this concept. And I mean, some of them might get it, some of them might not, but at least it's like planted a seed as to the importance of having something that's going to reestablish that connection from the knee to the brain.
Oh, cool.
And
That's
so
interesting.
I'll muscle test, yeah, muscle test and explain that. And 9 times out of 10, their knee or one of their knees is going to show some weakness on like 4 or 5 of the muscles that I'm testing, or at least a few of those muscles. And the neat thing is, on my re-exams when I'm done with my patients, now I know if they've been using it because they test strong or show improvement on most of them, like almost every time. So I know it's having an impact and its effects. So just from like a clinical standpoint there,
Mhm.
it's really helpful. Now, in
Well,
addition to that,
oh,
the way they
go.
like it,
Yeah, I mean, I mean,
yeah. So like
I was saving
they
that for
do,
the big finale, but that's phenomenal to hear because genuinely you know, I mean, to be blunt about it, we love to sell stuff, but we really want the product to help the patient. So it's really it's very gratifying to find out that the products are helping, doing what they're supposed to be.
absolutely. Yeah, and then just from the comfort level, the mechanical support that it gives, right? Because I mean, it's
Sure.
essentially like a sleeve that you can adjust with it, um, and it does offset discomfort. So it is like a nice thing to have on during the day. I've got patients that, we've done their protocols and they're on their like 3 month re-exam.
Mhm.
Literally today, this morning, she says she still uses it. She appreciates it. And she really likes it. It's very helpful for her. So it's just a win-win, in my opinion. So I mean, almost all of my needs, I'll incorporate that in their care plan. Um, and yeah, it's been super helpful.
Well, that's awesome, and not to feed you your lines, but tell me about ease of use for your patients. I would imagine that since your patients seem to be using it readily, they're finding it user friendly. Now, I don't want to put words in your mouth naturally, but I'm just curious about ease of use for your patients.
Yeah, overall, it's pretty simple for them. Now, just like anything, you got to take the time to show them how to set it up and educate them
Oh, of
on it.
course.
So, I mean, with the other clinicians on here, just take that extra 10, 15 minutes, walk them through it from start to finish, have them turn it on, have them feel it, right? You press on, and I'm very specific with them. I have them press it once. That's the blue. Then I have them press it again. That's the green. That's the one that we want to stay on, or vice versa. It's green then blue. But yeah, the second setting is the one I want them to use majority of the time.
Gotcha. Yeah, that's our the second program or second mode, however you want to reference it. That is known as our JSTIM Joint Stimulator. We actually developed that modality. It's proprietary to us, right? We developed that, geez, 15 plus years ago, man. Time time flies. But that's awesome. So
Yeah,
I'm
yeah,
genuinely really glad that your patients are getting benefit and getting better and feeling better. And ultimately that's what it's about. So I know you got to run, but unless there's something else you wanna add that could be useful to the audience. um you know
yeah. I mean, just real quick, and it's great because I mean, they can switch it to the other knee. They'll have it on 2.5 hours, and then
mhm.
they'll just move it to the other knee. So it's fairly convenient. It's not a big bulky device. So yeah, I just wanted to throw that in there. But I appreciate the opportunity here to share this.
Oh, listen, and feelings mutual. Thank you for the genuine feedback and the loyalty. And I'm going to let you run back in and get back to work. And thanks for sharing.
All right, Scott.
All right,
Thanks. Have a good one.
Sebastian, enjoy the day. Thank you very much.